Um, mm, mm, mm.
Welcome, everyone. I'm just gonna give a minute or so for people to log in. Since you're the host, can you let me know when, when there's like a break in the admitting of people, and then like somebody
Just
else is
made you
joining?
co-host. You can do it
Oh,
whenever you
I'm
want.
co-host. Okay, got it. Okay, thanks. Okay, awesome. All right, well, should we get started on time? Yeah. Okay. We're gonna get started on time, and if anybody's showing up later, that's okay because we're gonna have a recording of this available. So first of all, thank you all so much for being here and for making this webinar happen. Feeling lots of gratitude for being here. And so we're gonna go ahead and just do a quick welcome to everyone, and we'll introduce ourselves. This webinar came about because I've been having a lot of conversations with people about ketamine and ketamine-assisted psychotherapy, and really learning that there's so many misconceptions and so many questions coming up. So it became very clear that we need to do more education about this, and more just letting the community know what this is, what it's not, who it's for. So that's how the idea for this webinar came about. And we have here with us, we're very fortunate to have here with us Alex Goldman, who is the founder of the Keter Clinic, the Keter Ketamine Clinic in Jerusalem, and Eliza Goldman, who is a psychedelic doula and a wonderful facilitator. Actually, everybody here is a wonderful facilitator. And also Penny Boimel. I always mess up how I say your last name. Who is a psychedelic social worker, and really everybody here has a wealth of knowledge and experience to share. So why don't we go ahead and we'll start with introducing ourselves, and then we'll roll up our sleeves and we'll get into talking about ketamine. So Alex, you want to go first?
Sure. Hi, thank you all for joining us. We really appreciate you taking time to come and meet with us and hear what we have to say. Like Ruthie was saying, the main purpose of this is to educate people on the on the use of ketamine as a treatment in mental health, and tell you a little bit about um, how we're using this medicine to help people um, through different modality and through different challenges that they're going through. So to tell you a little bit about, first I'll tell you a little bit about my background. I'm a licensed mental health counselor from Milwaukee, Wisconsin. I made Aliyah about 5 years ago right before making Aliyah, I got trained in ketamine-assisted psychotherapy by Dr. Phil Wolfson, the, the, the guru of ketamine, the original guy who's been treating people with ketamine for many, many years. And it was a tremendous experience. So much so that when I made Aliyah, we did a training a couple years after we made Aliyah, and Phil came out and did a training with us, and that's what kind of got ketamine moving forward here in Israel. So soon after the ketamine training, about 3 years ago, we put together a team and started doing ketamine-assisted psychotherapy. Great team of people. We have Dr. Isaac Nagel, who's a psychiatrist. I actually got to work with him in an inner city clinic in Milwaukee. He was doing telehealth for that clinic there many years ago. And then when I made Aliyah, I told him about ketamine, and he was very interested in learning more about it. And he's been involved in the process of learning along with my close friends, David Alec, who's a licensed clinical social worker here in Israel, very well established in IFS here, and then of course my wife Aliza, who calls herself a psychedelic doula, to help work with. We work a lot with the religious community in Jerusalem. So in order to help people with their experience to feel safe and comfortable in their ketamine experience, I wanted my wife to get trained to be able to become a facilitator with ketamine as well. So that we did this. We started this about 3 years ago. I met Penny also at the training. He was part of our team when we went, and still part of our team when we first started. And we've been really working together for 3 years now. We've done about probably 1,300 sessions or so, maybe a little bit more, and we've seen a lot of it. We've got a lot of good experience. We've got a lot of good data under our belt, and yeah, we've seen that it helps those people it helps, and it's been a good journey so far for us in this process. And we've also done some trainings here as well. That's where Ruthie did a training with us. I see a few other people here did also the training with us. Welcome everybody. And the training continues. I tell people once you've done the training with us, you also get to then bring your clients to our clinic, and we get to help them, the facilitators along the way, and feel supported in their experiences. They're bringing their own clients to do facilitation at Keter. We provide the CLE, and the clients, the therapists that we train can then feel free to bring clients to work with their clients at Keter. So anyhow, I don't want to keep going because I can probably talk for a long time. So I will be quiet now and go to the next person, whoever Ruthie chooses.
Okay, let's smoothly transition to Aliza.
Hi, I'm Aliza Goldman. I guess the main thing that I wanted to share is why I'm involved in doing what we're doing. My husband first told me about ketamine-assisted psychotherapy, and I am not a person who was really interested in any sort of, I would call it a drug scene. That wasn't part of my youth, part of my college experience, anything like that. And so I heard about people using this somewhat psychedelic kind of medicine to supposedly achieve mental health. And when my husband was going on his second training with Phil Wolfson, and he encouraged me to come to be a part of it, my first idea was I should go and see what my husband's getting involved in, because if this is just people that are looking for an excuse to do drugs, that's not me. That's not something that I can get behind. So I went on the training, and I thought that it was life-changing. I believe that ketamine can be used to really help people achieve the things that they haven't been able to achieve in their lives up to this point. I don't believe that it's a miracle. I don't believe that it's the end all and be all, but I do believe that it is a tool that Hashem put into this world that a lot of people have been able to find tremendous help from. And so that's why I call myself a psychedelic doula, because more than anything else, I put myself in a position where women are coming to our clinic and they're looking for healing and they're looking for care. And people come and they can be nervous, they can be uncertain, and they need some care and they need some taken care of. And that's what a doula does. And that's what a birth doula does during a woman's birthing process. And I did train as a birth doula. I didn't ever really work much as a birthing doula, but I did train as a birthing doula. And so now I really like to take that level of being able to support women and help women through their own sort of emotional birthing process and help them in their healing.
Thank you, Eliza. That was beautifully said. Penny, you want to go next?
Sure. Hey, everyone. It's great to be here with my friends and partners in former crime, future healing. My name is Penny Baumel. I'm a social worker and a therapist. I started my work with psychedelic assisted psychotherapy and trained with ketamine-assisted psychotherapy, cannabis, and MDMA-assisted psychotherapy with MAPS. I'm the chairman of ACPT, which is a nonprofit here in Israel focused on making psychedelic therapy legal and accessible. As well, I am co-founder and coordinator and head of training in Sha'arei Nefesh, which is the public health Sha'arei Tzedek Hospital mental health clinic that uses ketamine-assisted psychotherapy, mostly for wartime PTSD and depression. And I'm very, very happy to be also on the team with Alex and Eliza and Ruthie and Keter, as well as other organizations in this field. Trained as a policy level social worker and then continued in my master's to also study drug policy and focusing research in the area of stigma and the way mental health professionals focus on their clients' drug use and what they think about drug policy. So I'm looking at this field from a few different perspectives. Very happy to be here and to talk about my experience in guiding and coordinating ketamine-assisted psychotherapy, both in Keter and in Sha'arei Nefesh, as well as the trainings that we participated in. So it's just great to be here.
Amazing. Thank you, Penny. And by process of elimination, I'll go next. So my name is Ruthie Eisenberg, and I'm a California licensed psychotherapist for the last 14. I've been practicing psychotherapy for the last 14 years and made Aliyah 4 years ago. And have an international practice going on right now with clients both in America and California, as well as here. And the reason I got involved in psychedelic assisted healing is actually coming at it from a psychotherapy perspective. I also wasn't so into the club/party scene. But I really started learning a lot about the positive effects of psychedelic assisted therapy on healing trauma and deep depressions and anxiety. And I got really interested as maybe there's something to this that could be helpful for my clients. And of course, anything that I offer to clients, I have to try myself too. So about 6 years ago, I got on this path of exploration and went through both informal as well as formal trainings through the Integrative Psychiatry Institute in Colorado, which focused on ketamine-assisted psychotherapy as well as psilocybin. and also through the Keter clinic, got trained in KAP, and one thing led to another, and that's how we're all here. So I'm also a trained yoga teacher and combine a lot of mindfulness into the modalities that I use for healing, and really just feel like it's so special to be doing healing on this land, and really giving these offerings and building our own and building these beautiful healing processes with psychedelics in our own cultural framework. So that's it for me. So let's roll up our sleeves, shall we?
I
And
just
get
saw
into it. Alex?
we have a very special guest I just saw join us. If Dr. Nagel can quickly
Oh,
introduce
Dr.
himself
Nagel is
for
here.
a second, I
Yes.
appreciate that. That'd be great.
Yeah. Hi,
If you're okay
Dr.
with that,
Nagel.
if you're okay with that, Dr. Nagel.
Sure, yeah, I can introduce myself. Hi, everyone. For all of you who have not met me, I'm Dr. Nagel. I'm a psychiatrist here at Keter. Have been working in the ketamine space now for a few years, all thanks to Alex, who brought me into this world. Um, uh, I really have found how ketamine has been such a powerful tool to help people make a lot of progress, both people with depression and PTSD, and it's been sort of a real pleasure working alongside with all of the numerous therapists that we have, and the Keter family keeps growing. So it's just so nice to see.
Thank you, Dr. Nagel. Okay.
And
Well, those are
Dr. Nagel, feel free to chime in anytime you'd like. If you have anything to add, we're always open to hearing anything you'd like to share with us. Appreciate it.
Maybe I'll pop off and then come back later for questions if there's questions.
Awesome.
whatever works for you.
What a nice treat. Thank you.
Amazing. Okay, so let's get into it, and let's kick off our discussion with what is KAP. And it's not the thing you wear to a baseball game. So what is the other KAP, ketamine-assisted psychotherapy? And maybe, you know what, why don't we do the poll first? Penny, if that's accessible right now, just so that we can connect with the people here and get a sense
poll,
of
only
who's here.
chat. Sorry.
No poll, only chat. Okay, so then
Maybe
everybody's invited to put in the chat. If you're somebody who is interested in ketamine out of curiosity, or if you're a professional, or if you're just curiously exploring, we're curious who you are and what brings you here. So if you feel called to share in the chat, you're invited to write a line in the chat. And in the meantime, while that's happening, there's a curious family therapist here. Welcome. In the meantime, while that's happening, let's go ahead and put the question out on the table. What is ketamine-assisted psychotherapy? What is KAP?
So if everyone's all right, you mind if I give it a shot and share a little bit about it, and then I'll let Penny take over.
Go for it.
It's okay. So in the world of ketamine therapy, there's really two basic models here in Israel. In America, there's a third model, which is an at-home model, but we don't have that access to here, and I'm not a big fan of it either, for safety reasons. But in Israel, we have basically two models of ketamine therapy. We have the medical model, which is a protocol created by the NIH, which is an IV protocol where people get 6 sessions over, let's say, 2 to 3 weeks, and follow-up sessions, every week or month, depending upon what the client's needs are. I'm not an expert on it, so I don't want to talk too much about it. I know that people have had a lot of success with it. I've heard really great things about it, but it's not the model we use. And we'll talk a little bit about why we chose to use the ketamine-assisted psychotherapy model, which is what we would call the psychedelic therapy model. Psychedelic, to share what I learned about the word psychedelic and how in the past it was used more of like the hippie, psychedelic, trippy, woo kind of drug experience. But I liked it more of along the lines of the psyche, meaning soul or spirit, and delos to mean to reveal or to manifest. So it's really about helping people manifest their souls and experience life from a better state of mind and a better place. And it's an enhancer and a catalyst that can help do that. So in the world of psychedelic therapy, there's really three things that we talk about. Two and three things that we talk about. The three things we talk about is the three phases of the medicine experience, which is preparation, where we help people get ready for the experience. Preparation can take anywhere from 1 session, 3 sessions, 5 sessions. It could be the way our model is set up here is I train therapists who are already therapists, so they already have a relationship with their clients at times, and they've maybe seen their clients for 20, 30 sessions, but they're stuck. And so part of this, like I said, the psychedelic model is preparation. Then there's a journey, which is the medicine experience itself. We'll talk a little bit more about how we use it, like specifics, but for this purpose, we'll just talk about the journey, which is when the person's on the medicine, and there's a facilitator sitting with them, supporting them during the experience. The real goal is I see this psychedelic facilitator is to make the client feel safe to have their experience, and to support them along the way in that experience. And part of it also is we also work as a scribe and collect data for the client in order for the client to use for the third phase, which is called integration. Now, regarding the journey phase, there's I was saying there's 3 things and 2 things. There's 2 things we talk about in the journey phase, which is which is mindset, and setting, which is the physical location and the setup of the room and the setup of who they're with and the music and the many different factors that are involved in it. But it's really the scene, the petri dish, whatever you want to call it, for the client to have their experience. And then the third phase, which is integration, and that's taking oftentimes what the client experienced and helping them integrate change into their life. And there's reasons that we do it this way. It has to do with neuroplasticity and the brain development, which is the biological component of ketamine. But what we're doing is we're melding the biological with the psychological and really enhancing. Like we like to look at it as the gold standard of therapy, where the client's not just getting the medicine, but they're also getting the integration and the therapy to go along with it. Because really, without the integration, there might be some change, but the lasting change, without a person really changing their mind or changing how they view things, and then they're really just going to revert oftentimes back to old behaviors and old patterns and old ways of saying things. So we really look at ketamine as a catalyst to enhance therapy. As one of our clients said, she was looking for nirvana, but she saw that ketamine really helped grease the wheels for therapy. It made therapy much more effective. So that's the 3 phases that I see in kind of the differentiation between IV ketamine, the medical model, and I mean, there's a lot more differences, but in the intramuscular, psychedelic model of ketamine that we're using here at Keter.
Yeah, Penny, did you want to add something?
Yeah, if you don't mind, I'll share 2 slides. I'll say some background stuff about ketamine, and then we'll continue moving on, if that's all right.
Yeah, please do.
Perfect. Thanks.
Great. So I just wanted, can you see my screen now?
Yes, but I don't see the slides. Here, now I see it.
Okay.
Hopefully
So if you
everybody
can,
can see it.
sure, if you see it, then so can they. So psychedelic assisted therapy, I will just say, zooming out of ketamine for a second, utilizes therapeutics, talk therapy, sometimes somatic interventions or other types of therapy, but combines therapy and an experience facilitated by a certain molecule or molecules. In the case that we're talking about ketamine, there are many different ways to combine substances and therapy. And if you look at the bottom of the screen, you'll see there's this graph showing from a range of from the biochemical mechanisms, meaning ketamine has been proven to affect your biochemical system in this way, enhancing certain things, and then helping as a biochemical agent. Similar to that, we could see every other psychiatric medication being given. On the other far edge of this range, you can see models that are focused on the emotional, psychological transformation that happens within a journey, within a session using medicine. And in between them, there are different various models showing the combination. And when we're talking about KAP, we're usually talking about either psycholytic or psychedelic models, meaning either low dose and lots of conversation, or high dose and lots of transformation, combinations of medicine and therapy. Second. And just a little background about ketamine. So I'm not going to go through all of this, but you can see that ketamine has been around for many years. It's been a established, very safe substance used for anesthesia and for pain. It's been approved in 1970 by the FDA and has been classified both as a controlled substance since 1999, but also as an essential medicine to be available in every medical facility since through a decision of the World Health Organization. And it's been used initially, like I said, for more physical things. But since the 1980s, late 1980s, early 1990s, we have studies for depression, PTSD, anxiety, suicidality, and also other conditions, even addiction treatment, for example. How does ketamine work in our system? Very briefly, ketamine works on our NMDA receptors and is affecting our glutamate system, for those of you that this means anything to. But what it actually does is increase our neuroplasticity, meaning the flexibility in which our brain creates and uses connections, and also produces a situation called disassociation, to be distinct from the dissociative symptoms of PTSD, for example. When we say disassociation in ketamine, we're talking about a distance, a perspective that allows us to be in touch with sometimes very difficult material in a way that is shielded in some way. So we'll talk about that and how that comes into play when we're talking about working with trauma or suicidality. But in that state of consciousness, which is different from our usual, we call it amplified or changed states of consciousness. We might see things, we might hear things, we might experience emotions, or go back in time and visit memories that weren't accessible. There's all kinds of different experiences that can happen there. There are also some small but existing risks that have to do with ketamine. During the experience, there might be dizziness or nausea or confusion. There can also be a somewhat risk of addiction when we're talking about uncontrolled use outside of clinical work. You want to say something, Alex?
Yeah, I want to talk about. I want to emphasize the safety and the risks involved with it. Penny mentioned earlier how it's a really safe anesthetic. One of the reasons it's a safe anesthetic, and of course we're using it at much lower doses than anesthetic doses, but it doesn't suppress the respiratory system, so it doesn't prevent a person from breathing. It doesn't affect their breathing, so it's safe on that level. Which I really like. With regards, there are people who do abuse everything. Ketamine is one of those things that people abuse. One of the ways we reduce that on our side of things is the clients never touch the medicine. Whereas in America, there's different ketamine programs where people get sent ketamine to their house, and they have then access to the medicine to either use intranasally or use sublingually. Even now, I think they even have subcutaneous, meaning where they're just injecting it underneath the skin level. So that's a much higher risk of abuse and safety. I think we always joke and say that the most dangerous thing about ketamine when we use it under our setting is when the client has to go to the bathroom in the middle of their journey, where they have to like walk and they kind of have like sea legs and you can't hardly stand up. But with regards to like safety of the medicine, controllability of the medicine, it's a really, really safe medicine. And that's one of the things I really like about it. It's very predictable in a lot of different ways. But with regards, so I'm saying it's with regards to abuse and dependence, the way we use it here, we really try to put barriers up to prevent that.
Yeah, and just to add to the safety piece, also the dosage that you would be getting in a ketamine-assisted psychotherapy setting is a lot lower than a dosage that somebody would be getting, even a neonate would be getting in a surgical setting. So, if higher dosages of ketamine are tolerated during surgeries by people in very vulnerable and compromised physical states, then this is very safely tolerated in the therapeutic setting at a much lower dose.
Right. So this is the medically established safety that you could see written here, but I want to say that also on a psychiatric or even psychological level, ketamine is somewhat predictable when we discuss dosage. For example, we can expect the different ranges of doses to bring somewhat similar experiences for different people, as well as also we kind of know what kind of people shouldn't be in ketamine treatment because they're predisposed to be harmed by it, as opposed to the majority of people who would be very safe. Another thing very important for safety is the fact that ketamine is a substance that mixes very well with most, whether medical substances or recreational substances. And the risk of poly-drug use or multi-medicine and ketamine use is much less than, for example, when we're talking about MDMA research, where people, for example, who are on SSRIs need to taper off of their medication to start the treatment, for example. So that means that we can safely combine ketamine with a lot of different medications, and most people can actually tolerate that very well. Reasons why ketamine has become so popular and is such a good tool also include the fact that it's accessible under off-label regulation, which means that doctors can request special permission to use this medicine not only as anesthesia, but in our case also for psychiatric reasons. And that allows us to be more flexible with how we use the medication. Another thing is that the low cost of ketamine, if we're comparing what the actual medicine costs, which is a few dozens of shekels per ampule for the substance itself, versus MDMA or psilocybin, for example, in trials, which can reach thousands of dollars for a gram because of the way that the regulation is structured. Ketamine is just that much more of a accessible treatment than the other substances.
The expensive part in ketamine is people's time. It's 4 hours of a facilitator, nurse, doctor's time, and but the medicine itself is really cheap, and it's a medicine that's not what's it called, patented, so it's no longer under patent. So it's really inexpensive and easy to get, and easy to have access to as a treatment.
Definitely. So what we're going to be talking about, which is ketamine-assisted psychotherapy, is utilizing what we call here the therapeutic window. Giving someone ketamine creates a relief that we'll discuss in a minute, but it also creates a 24 to 72 hour long, this is according to research, for some people that could be longer or shorter, but a window where we can intervene. And if we're talking about suicidality, for example, or PTSD or very deep depression, that's where we can bring in psychotherapy and make a very big difference, and make, because of the flexibility, because of the neuroplasticity, make a bigger impact on the behavioral change and the emotional state of the person. Like Alex said before, the different types of ketamine treatment could include either IV, which is into your vein, and IM, which is into your muscle. Just ways to remember that. IN is into your nose, and SL is sublingual. So those are four very common ways of using ketamine in different treatments. Like I said before, there's psycholytic therapy, which is, I just want you to know that term, which means having a lower dose and more psychotherapeutic oriented conversation under the influence. If you can think about the reason why people go to a bar and open up to their barman after they had a shot or two of whiskey, and they can share things that maybe they wouldn't share with their therapist or their doctor. So that kind of easing of our barriers that happens there can happen with ketamine in a way that if you put that into psychotherapy, you can really make a big difference in the way the connection between the therapist and the client. Sparvato or esketamine is a whole different story. We're not going to get into that, but it's a very common treatment that is comparable in some ways, but is 1,000 times more expensive per milligram of substance, and is covered in some states, including Israel, by HMO or by different insurance company coverage. And we're going to be talking mostly about KAP, so I want you to think more about KAP. Just very briefly, some research about the evidence for ketamine being useful for different mental health situations. And you're all welcome to take a screenshot of this or check out these sources later. But we see research also in suicidality, also in antidepressant effects, also in PTSD symptom reduction. We see outcome over time with 30-day and also a year-long researches who have been done, and ongoing research currently for 3 and 5 years after treatment also happening in the world. And we see that the numbers here and the speed of things changing in therapeutic processes are much higher than what we are used to in the mental health world. Just one little last bit is ketamine-assisted psychotherapy being somewhat more useful, not completely proven to be overwhelmingly better than ketamine without psychotherapy, but we definitely see how KAP enhances the therapeutic effects of ketamine and makes them more meaningful and also longer lasting. It also brings down the anxiety and the concerns about the side effects and creates a safer and less addiction-prone situation for clients. And this is just like a very small taste. I want you to, if you're interested in this, to go and read more about this. But this was just like a brief overview about ketamine and ketamine-assisted psychotherapy. So the situation in Israel, and I'll say two more sentences and then I'll move on to Ruthie or Lisa, is that we have a few private clinics in Israel doing ketamine-assisted psychotherapy or ketamine treatments without psychotherapy. And we also have some hospitals doing Sparvato treatments or esketamine treatments, as well as currently 2, soon 3 hospitals doing ketamine-assisted psychotherapy. So this isn't very widespread yet. It's not completely known and understood by most of the people, including many of the professionals. So not all the psychiatrists in Israel or all the psychologists in Israel actually realize the potential, the safety, or even the situation that ketamine-assisted psychotherapy could help in. So when you're reading and researching about ketamine-assisted psychotherapy, please consider the fact that, especially in Israel, this is very new, and that we're still kind of developing this field. And yeah, I'll stop here for a second.
Thanks, Penny. Wow, that was really comprehensive and really thorough. I feel like you really shared a lot. That was great. So let's chat a little bit about, I want to maybe zero in a little bit more on the therapeutic process, and if we could break down preparation, what happens during preparation, what happens during dosing, what happens during integration, so that people can have a clearer picture of what the process looks like and why it's important to even do preparation. There's many, I know that in America, there's certain ketamine, not ketamine-assisted psychotherapy, but just plain ketamine clinics that don't have that kind of therapeutic support and container and just send ketamine to people's homes. And and then the person takes ketamine, they do a dosing journey, they might feel good for a few days, and then a few days later, they're back, they're back to where they started and wondering, why isn't this working? Isn't something supposed to happen? So let's dig in a little bit let's start with preparation. And why is that important? And what happens during preparation? So, Aliza, do you want to chime in here?
Sure. So I'm actually in a somewhat unique situation because I do not work as a therapist. I work as a facilitator. I work as a support for the women who are coming. Sorry, I have to gather my thoughts for a second. Okay. Sorry about that. So I'm in a unique situation because for me, I'm usually having somebody come to me that is saying, "Hi, I'm interested in trying ketamine-assisted psychotherapy because I have a certain block, a certain thing, a certain progress that I haven't been able to make through the therapy that I'm doing, or I've tried different medications or this or that." And they come to me when they've already met with Dr. Nagel, they've already gotten their prescription for ketamine, they've already been approved to come to Keter. And so my first meeting with these people, with this woman, I basically say, what are you looking to open up to? What are you looking to achieve? And then I kind of talk them through what they can expect from their experience. So I let them know that they're going to be coming to Keter, and it's a very comfortable space that's almost set up like an Airbnb. I let them know that I'm going to be there. I'm going to be there the whole time to support them. I'm going to be acting as a scribe. I'm going to be acting as any sort of support. And it's all about them, and it's all about their experience. And I want them to have a really good, positive, really lovely experience, to the extent that I like to even call it their psychedelic spa day. And so they come in, and I'm there and I get them comfortable, and we schedule 4-hour sessions. I say nobody ever has to stay for the entire 4 hours, but I'm committed to being there for the full 4 hours. And yeah, and I'm there to help them, and I'm there to support them. And based on something that Penny and Alex were both talking about before with regards to the integration work, I like to say that using the medicine without the plan for the integration is kind of like using drugs. And I'm here for people's change and for people to really achieve what they're looking to achieve. And so even though I'm not doing the large amount of integration work with them after the fact, I like to work with people who have established relationships with therapists. My main thing is, what kind of work are you going to be doing after the session that we've had together?
Yeah,
Yeah, that's great. Alex, you want to chime in?
Yeah, I wanted to say one of the unique things about Aliza is that she's working with people who are already working with therapists. So she's really just doing the facilitation work with them. So her prep is going to be different than someone's prep like Penny, who's working with an established client, has a relationship with the client. So again, it really enhances the relationship as a therapist to be doing these types of things, work with your own therapist. But for some therapists, they either don't want to get trained in it, they see a value in it, but they just don't have the time, because it is 4 hours. It's a nice chunk of time, but it really is an enhanced therapeutic experience for the client. It can be, but again, like Aliza was saying, the important thing is that after she does the work with their clients, is that they're doing integration with with their own therapist, and we send them home with like the notes that we took, the things that they shared, the insights they may have had, and then we'll send that back with the client to work with their own therapist to do the integration. So, or for therapists who are working with their own clients, we make sure that that follow-up session is usually happening within 48, 72 hours of the ketamine journey, because that's really where the effectiveness can be enhanced. Penny, you were going to say something?
Well, I was actually going to add to what you were saying is one of the other things that we are doing at Keter, at our clinic, is we're training therapists to be able to sit for their own clients. So I think that that's really important and very impactful. Somebody might say, I see a lot of people in the chat have mentioned that they are family therapists, that sort of thing. So at the end, we'll mention we do have another training coming up. But I think that that's amazing that there are therapists who want to understand more. People here on this chat who after this Zoom tonight, and they're really interested in getting trained so that they could bring their clients to an extra level of healing, an extra closeness within their relationship, that sort of thing. And so, yeah, that's what we're doing at Keter is in addition to sitting for our own clients, we are training therapists to be able to sit for their clients.
I'm going to address.
Yeah, I can really attest that it's a really amazing experience to be trained at Keter and having that, not just the academic piece, but more the experiential piece of actually sitting and facilitating for other therapists who are in training, and also having them and also experiencing the medicine as a participant. Penny, you want to weigh in?
I'm going to address what you asked about preparation. I think that regardless if this is a client of mine that I'm bringing in for ketamine, or if this is a ketamine client that's just getting facilitated for a session, there are certain things that we do in preparation, and that has to do also with what a session looks like. So for those of you who don't know what a ketamine session usually looks like, imagine somebody laying down on a comfortable bed or sofa with their eyes covered, music in the background, soft setting, and in this soft setting, the person might be going through a very difficult experience. He might be going through a very beautiful experience. He might be going through a very boring experience. There can be a wide range of how that plays out. In any case, preparing for that means that we need to create some kind of understanding about boundaries, a conversation about what kind of music we'll be playing, what kind of support we'll be using. For example, will we be using hand holding? We'll be using our words during the session. So we create in the preparation and understanding for the client also what will and what won't be going on in this journey, and how we will be intervening. Another thing that we discuss in preparation, like Aliza said, is the exit strategy or the integration plan for after. What am I going to be doing when I go home? What am I going to be doing to utilize that window of 24/7, 2 hours after that we discussed? Obviously, if we're in therapy and we're bringing a client in, the integration process and the preparation process happens in our one-on-one therapeutic conversations. But especially if we're doing this with a patient outside of a therapeutic context, we'll be preparing them to feel that they can trust us and themselves and the medicine. So all three of those. And we'll be helping them figure out how to navigate in the experience somewhat, which is not easy especially for the first session or two. But understanding how to be in touch with our body, how to be in touch with our breath, how to work with the music. So all those things will come in the preparation. Another thing is we'll tell them how their body might respond to this, so it doesn't freak them out when, for example, their lips go numb or they can't really move their toes when they want to. And that part of the preparation is also to reduce the anxiety in the experience, and also to bring a little bit of control to an experience that inherently has surrendering of some of the control that I have. So mostly I'll try and focus in preparation on creating safety, trust, and also common language and common ground for us to have that communication, even in a situation where the person is very deeply in an internal experience and I'm sitting there and I don't really know what's going on. But just making sure that I can be there and be supportive.
Yeah, that's great, Penny. And I just want to add to that also, during a preparation time is a really great time. It's kind of like if you're going on a travel, you want to make sure that your suitcases are packed. You want to make sure that you're bringing the things you're going to need in the desert or in the jungle. So we can think the same way about preparation for a big journey experience. And it's really preparing the mind, but also the body to receive the medicine in the most optimal way possible. If you have an important guest who's coming to your house, you're probably going to clean up and organize your house and have some food ready. Like you're going to prepare. Well, maybe you won't, I don't know, but I would prepare. I think most people would prepare. So it's the same thing here. We really want to have support with preparing our body and also our mind. And we prepare the body through teaching perhaps some breathing skills that can be helpful during during the journey. We can prepare the body through just forming some healthier habits ahead of time around eating, around movement, around sleep. So these are some ways of preparing the body. Then we also prepare the mind, and we can do that through, in addition to everything that that Penny and Elisa and Alex have said, through supporting our clients with setting intentions. Are they coming to a ketamine journey for healing, or are they coming to a ketamine journey for learning? What is the kavana? What is the intention that they're bringing into a session? Why are they doing this? How is it going to help them live life better on the ground? So these are some of the questions that we might want to explore with our clients to really get clear on why is this the experience that we're seeking, and versus a different experience, and how do we want to harness this experience to really enhance our well-being and meet life with presence and with kindness, and in the way that and with health in the way that we in the way that feels meaningful and aligned with their values. So
Yeah,
just wanted
Ruthie, I
to
completely agree with what you said. I mean, anything in life, I would say the more you put into it, the more you get out of it. And so the holiday of Shavuos is coming up, and yes, somebody could just show up and Shavuos is going to be there regardless. But the more preparation that a person is doing, the more they're going to get out of the Chag. The more a person prepares for Shabbos, the more they're going to get out of it. The more a person prepares for a trip, the more they're going to get out of it. Yeah, you could show up um, in an amazing destination in this world, but if you haven't actually learned anything about the history or what's unique about it or whatever, then how much are you going to get? Not as much. And so certainly the preparation that a person does before a ketamine session is the more they're going to get out of it. At the same time, I do encourage my clients to come with very loose intentions. Somebody could come saying that they're coming to really focus on their relationship with their spouse. And while they're in the medicine itself, and then the time afterwards when they're talking and thinking and doing the integration work with their facilitator, it could be that really that's not what's weighing on them, and instead they're really focused on a childhood situation that they want to work through. And I always like to tell my clients there's no wrong way to journey. There's no wrong way to experience the medicine. Everything is exactly right, and it'll take you exactly where you need to go.
Yeah, exactly. I love that. And what you're saying about the intentions and not getting too attached to the intentions, having looser intentions, it reminds me of something that I think somebody said it during our training. It's kind of like your intentions is like holding a bird in your hand. If you
Mm,
hold it too tight, it might die, and if your hand is too open, it might fly away. So we want to hold our intentions very gently.
yeah.
Yeah.
You did say that some people come with the intention to learn, some people come with the intention to grow, to heal, that sort of thing. With all the trainings that I've done, and we've trained quite a few people at this point, and I've experienced quite a few trainings, I don't know anybody who's going into a ketamine journey without their own hope for some sort of healing, growth, that kind of thing, no matter if they come to the training specifically to be able to learn how to do this with their own clients. I mean, we're all open-minded, growth-oriented people, healing-focused people. So everybody's looking to get something amazing out of the experience, I would say, something growth-oriented out of the experience.
And one of the challenges is when we're setting intentions for clients is expectations too, because some clients are expecting to have these really powerful, life-changing mystical experiences, and then they don't get that. There's a range of what people get on the ketamine experience, and it depends upon dosing, it depends upon sensitivity to medicine, it depends upon how safe they feel, how willing they are to let go. And so there can be a big range, but sometimes people are let down by the journey. So one of the things I always tell my clients is don't judge the effectiveness of the medicine by the quality of the journey, because the medicine can still be biologically effective. And for integration purposes, which is really where, the rubber hits the road, and really what makes ketamine the most effective is how it affects the therapy afterwards. But the journeys, listen, people have had tremendously beautiful, powerful experiences on them. And some people have had I just felt like I was sleeping, experiences on the medicine. And part of that and part of the learning process when we're working with our clients is that we understand how the medicine affects them, what the experience they're looking for oftentimes on their journey. Because we may have clients coming in who have recently experienced heavy trauma, and we're not going to send them, blast them out. We'll take a much lower dose approach to work with these types of clients. So, the medicine, the journey experience has a big range of what people are going to experience. And one of the things that we are lucky to give our people that we train is experiences on the lower doses and on the little bit higher, more mystical experience dosing. So that they know where the client's going to go and know how to support the client in these experiences. The lower doses can be tremendously effective and tremendously insightful for people. And the higher doses can as well, but the amount of medicine isn't necessarily, or the effective or the quality of the journey itself isn't necessarily dictating the effectiveness of the medicine.
Yeah, that's true. And sometimes people think that a higher dose is more desirable for bigger effects. If you take a higher dose, you're gonna get blasted out into space and have this mind-blowing experience. But with ketamine, you really want to get to that sweet spot window, because if the dose is too high, remember, it's a dissociative anesthetic. So you might kind of cross over that threshold and really not experience very much on a dose that's too high for you. So it really is about hitting the right window of dosing, and higher is not necessarily better.
And as as our therapists gain experience, one of the things we do, as they're learning, as the facilitators are learning in this process, is we sit with the clients and the facilitators to discuss dosing and to describe the experience, what it will be like for the client. So to kind of give you guys a little bit of understanding, if people have done breath work, type of tumo breathing, where you do that fast inhalation, exhalation, or a person who's had a nitrous oxide experience, either at the dentist or at a Grateful Dead show. Maybe nobody's here old enough for that, but that is what the kind of the medicine feels like, sort of, or more like a dream, more like a floating experience. One of the things about ketamine and how we're using it in the IM setting is after the injection, after about 4 minutes, the client starts to feel tingles on, their extremities, their lips start to go numb. Their ears might start to ring. After about 10 minutes, they're entering the peak experience. Usually, not usually, but oftentimes we will, and this is all done ahead of time, just, either oftentimes boost the medicine at that point, give them a little bit more medicine to extend the peak experience. The peak lasts somewhere between 25 and 45 minutes, and then there's a come down point. So it kind of looks like a little bit of a bell curve, but with an intramuscular injection, it's a pretty rapid onset. Peak experience is about 25 to 45 minutes, and then there's the come down or the long tail. And it's in the long tail where we often do the psychotherapy component of it, where we ask questions to the client when we see that they're kind of, because of the disassociative nature of ketamine, it really feels like you're leaving your body. I call the body the meat suit or the space suit, right? The you that's in there the body doesn't exist within your consciousness in the ketamine experience. So we see the client when they kind of enter back into their body, they'll start wiggling their fingers, and you can see they're like coming back down. And when the client's ready to talk, we'll say, are you ready to share about the experience? And oftentimes start opening up, or they won't. Like Elisa said, there's no wrong way to do this. So our job again is to support them in the experience, and then hopefully send them home with something when the experience is over.
Yeah. And it's interesting, Alex, you're mentioning the timing arc of the journey. And I want to add that during a journey, when you're on that experience, time is not really a concept. So 5 minutes can feel like an eternity. The journey might feel very short. 25 minutes or 40 minutes can feel like 1 minute. So time becomes very warped, and it's not registered like, usual time in ordinary daily life. Um, but that being said, one of the advantages of ketamine-assisted psychotherapy is that it is a shorter duration for a journey compared to certain other medicines, like psilocybin, for example, is a much longer. You need a whole day for that. Here, it's 4 hours tops. I mean, for the rest of the day, I wouldn't have too much planned. You want to take it easy for the rest of the day, of course, but it's not an all-day experience. You can have a morning, for example, and then do your journey in the afternoon. Whereas with something like psilocybin, you really need to carve out at least the
And
8 hours.
ketamine's a lot more
Yeah.
predictable as well
Yeah.
than psilocybin.
Yeah.
I don't know if this is the right time to mention that I personally encourage my clients to come for a minimum of three sessions. There's a lot of fear oftentimes with people who are coming in for their first journey, and we usually give them a pretty low dose of ketamine. And that first journey can oftentimes, not take them to a very
Be underwhelming.
it can be a little bit underwhelming, and because I don't want to overwhelm them. And so we err on the side of caution, and we keep things kind of gentle. And then the next session, we might go a little bit higher and see how they feel with that. And then by the third session, they're a little bit more familiar with the medicine. They have an idea, a little bit of the fear is gone, and they have an idea of where they're going to go, and also what they hope to get out of the actual experience itself. And so at that point, we start being able to have more of a conversation with them. Are you looking to have something more like the first one that was more psycholytic, where you were able to kind of discuss with your facilitator the whole time? Or are you looking to experience something deeper? So those are the kind of conversations we're able to have once we get rid of the fear of the unknown with the first one or two journeys.
Yeah.
Oh, another thing though I wanted to mention is that regardless of what the dose is, a person can absolutely experience tremendous benefit, tremendous growth, tremendous change. Again, I'd say that it's all about the integration, and whether we're talking about a low dose where a person does not have any sort of an out-of-body experience where they basically feel like they've maybe drunk a few glasses of wine, to somebody who really feels like the world ceased to exist. On both levels, the days and weeks and even months afterwards, a person can still have tremendous impact. It can still have tremendous impact on a person's life, on a person's healing process.
Yeah, absolutely. And I also want to maybe take this moment to address some of the fears, because especially trying something new for the first time can feel kind of scary, and venturing into the unknown, it requires a lot of courage, but it's also normal to feel nervous and a little scared. So I'm curious with people who are here, if you feel called to write in the chat, what are some of your concerns or some of your fears or some of your hesitations about ketamine? Or perhaps what are some of the things that might feel compelling to you about trying ketamine or
While
recommending
people
it to others? Yeah.
while people are thinking and maybe sharing, I'll let people know that I like to assure my clients that, first of all, they're not going to do anything completely off the wall that they would be horrified about themselves. They're not going to undress in front of me. Um, they're not going to, trying to think. They're still going to have a certain degree of control. And then also, I like to reassure people that the medicine is safe. It's being administered by a medical professional, either by Dr. Nagel or by one of our nurses who come in to administer the medication. The medication is safe, and that is exactly what my role is to be there and to make them feel safe and to make them feel taken care of.
Yeah. And it's also a round trip. So we have to remember that as well. That yes, once you take the medicine, you're kind of buckled in for the ride. You can't really get off the boat at that point, but you will return. And wherever you return, it's going to be a different place than where you started from. But you will return back to your normal consciousness.
And also, oftentimes allowing a person to experience something that they might be scared with, but feel supported in something that's scary, and to be able to explore things that are scary instead of avoiding them. So it gives a person an opportunity to do something they might not normally do, but in a very safe environment. So
Yeah.
yeah,
Yeah.
and
And
that in itself can be really huge for people who aren't used to stepping out of their comfort zones, and aren't used to, exploring the unknown and feeling safe. So.
Absolutely, especially for a lot of people, one of the biggest universal fears is the fear of death. And with ketamine, you get kind of a time out from your body, you get a break from your body. And there can be something really, really healing and really powerful about that, to take a break and realize, what the gift and the beauty of life is really about. So having fears is not really a problem. It's kind of like a solution. And they say the only way out is to go through, to approach the fears. But how we approach the fears really matters. And we want to approach the fears with support, with safety, with our tools, from a place of being really resourced. And that makes um, the experience much more palatable. So there's something really special about facing things that are scary, but also at the same time having that container of safety and really holding both the fear and the safety at the same time. It can be very, very powerful healing, and certainly something that I've experienced during my journeys with Keter. So I don't know if
You got anything to add?
add anything, Penny?
Yeah, I want to say that I don't want us to be confusing defense mechanisms with fears. People come in with their defense mechanisms for a reason. And I think we try and honor that and respect that and work with the defenses that people bring in, especially if we're talking about PTSD, and even if we're just talking about any other situation that is, steeped in 2.5 years of being at war. So respecting people's mechanisms, whether that means dosing according to what they'll need, or making sure that the preparation was robust enough, or making sure that the support during will include what they need. And sometimes that could mean, for example, making sure that the music is culturally appropriate, for example, or making sure that whatever this person needs in order to feel safe and comfortable. And those are the 2 words that I use to try and get a person not past their fears, but bring their fears with them through the experience. So safety and comfort are what helps that a lot. I also want to add something about stigma. Mental health situations are stigmatized in our society. Ketamine or other substances, but even especially ketamine, is stigmatized, and nobody is coming in with a clean slate about this treatment. So if you're coming in with PTSD to get ketamine treatment, as a facilitator, I'm going to be honoring and noticing the fact that you might have a biased opinion about how ketamine works, what it might do for me, what it might not do for me. And also, I'm going to try and create the psychoeducation that's needed for a person to understand what it means that they have PTSD, for example, because they're not always, in that diagnosed for years. Sometimes they've been diagnosed recently in order to get into this kind of treatment. So just understanding that anyone, including ourselves as therapists or clinical leaders or researchers, we are in a stigmatized perspective about the substance and about the situations that we're dealing with. And psychoeducation helps both me and the client align ourselves to the kind of openness, acceptance, attention that we want to put into this.
Mm-hmm. Yeah. And that might be really good segue to talk about who ketamine is indicated for and who might not be a good candidate. Under what circumstances might somebody not be, ketamine might not be the treatment of choice for them?
Just Ruthie, before we jump into that, I just want to address one of the fears that were written in the chat. So I saw half of it,
yeah.
Okay. And I want to say something about a misconception that is very widespread also among therapists about how ketamine or any psychedelic experience works in therapy. The thought that this journey will bring up content from my past that is either traumatic or unknown to me or forgotten to me, that might happen, but that's not why we go into an experience with the substance. Meaning, under the ketamine's influence, you might be more receptive or more open to going back in your memory and examining some traumatic content, for example. But the misconception of trauma erupting or information falling down from the sky into my experience, I gotta say that in the past 200 or 300 people that I saw on ketamine, it's very rare that happens, especially if that isn't the intention. Meaning what comes up, and we said before the word amplifier, what comes up in these experiences, an amplification of our intentions and what is in our psyche at the time. So there is a small chance that you might experience in this journey new memories, for example, or content that you missed out on or you put aside because it was too traumatic. That's why we have the facilitator there. That's why we have integration processes planned out. that's not usually the intention we go in with. Even when we're working with PTSD, so for example, the kind of clinical work that we do at Shalom Nefesh with, Zaka volunteers, for example. So sometimes, especially after prompting that and talking about the difficult experiences in the chair where they're going to do the ketamine a week before, then yeah, of course they're going to be experiencing in some way, visiting the horrors that they came across. But if this isn't the intention and this isn't part of the psychotherapy and this isn't part of where we're trying to lead that experience, most of the time people are going to go either into an imaginary, mystical type space, and they will be experiencing, maybe a collage of memories and imagination and a mixture of things that sometimes kind of combine reality and imagination, maybe. But that fear of I'm going to get too much information that I won't be able to hold, I think that the answer to that is psychotherapy, 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 ketamine, psychotherapy, psychotherapy, ketamine, meaning building out a process for you. And the worry about you not being able to hold that first, eruption of experience, I think I just want to put whoever asked about that kind of at ease and say that even if that does happen, a therapeutic relationship is meant and supposed to and can hold that information with you and help you do the integration. And don't rush into the next ketamine experience until you're ready for it.
Mm-hmm. Yeah, that's great. So I'm noticing our time, and I want to make sure that we have enough time for Q&A. So let's just quickly go over what ketamine is, who would be a good candidate for ketamine, and under what circumstances is ketamine contraindicated. And then we'll go to our Q&A.
So I see that Dr. Nagel
Good.
just came on the call. Maybe he might be open to answering that. Are you up for that?
Yeah.
Sure. So ketamine, to be able to get ketamine approved for treatment in Israel, for me to be able to see the patient, write the prescription, there's 3 options to be able to send in a 29 Gimel, which is a form to the pharmacy to be able to get ketamine filled. They have to either be diagnosed with treatment-resistant depression, PTSD, or suicidality. So one of those 3 options, I can prescribe ketamine for those 3 indications. I think that ketamine can be helpful for lots of other indications, and so but in terms of those are the only 3 right now that it is currently able to be used for. As I saw someone asked about complex PTSD, and I think complex PTSD is just sort of a different type of PTSD. I usually that's probably one of, I think, the most common reasons people are coming to Keter, because usually often people who are struggling with depression and they're in several different therapies and nothing's working, and they've tried medications, they've tried therapies. That's what usually sort of brings them to ketamine-assisted psychotherapy, often because of sort of complex trauma that they've been through. And so that there's definitely lots of clients that meet the criteria for ketamine treatments, for ketamine-assisted psychotherapy, just because the whole country, we've been through 2 years of war and lots of different challenging struggles, and that's sort of over and above a lot of people who've had challenging childhoods as well. So yeah, there's definitely a broad range of other things that it can be helpful for, including addiction, including lots of different types of anxiety, OCD, but I would say probably the only criteria for someone I would not accept is if they have some psychotic level disorder. So either if they've been bipolar with manic and psychotic symptoms, or if they have a history of schizophrenia, those tend to be people I would, even if they have PTSD symptoms, I would not want to treat them with ketamine-assisted psychotherapy. And so that's kind of, I've turned down a few people because of that, but that's generally sort of the inclusion and exclusion criteria that I've been using.
Yeah, that's great. And for
Additionally,
people who have
biological,
psychotic profiles,
I was going to say there's a few biological reasons as well. Pregnancy, uncontrolled high blood pressure.
right.
I think
For
so.
people trying to get pregnant, also it's contraindicated. Somebody's trying to get pregnant.
Yeah.
I'm going to add as a
And also
social
for people
worker.
who have psychosis, and also for people who have psychosis background, there are, all hope is not lost. Like there are other therapies and other treatments that can be very helpful and supportive, but it's just not ketamine.
Yeah, another thing I want to add is that if you don't have the right support system, meaning if you're going back from a ketamine treatment to just, let's make it extreme, living on the street, for example, then I wouldn't want you to go through that experience and then not have where to land and do the integration process. Another example could be if you're living with your parents and you're hiding the fact that you're going to therapy, or whatever other reasons that people, and these are just clients that we've met. If you don't have the right support system for this kind of process, then adding a power tool into it would make that need even greater. And I'm adding on to that also the fact that some of the clients, for example, that I've worked with over the last 2 years, going back to Miluim service right after ketamine treatment could be very, very difficult. That in some places, for example, in Ukraine, the military's been using ketamine treatment to help soldiers recuperate and go back to battle. But I want to say that from my perspective, for most people, what would really, really help your ketamine and your psychotherapy processes work is if you have the support system to hold that. So that's just another thing.
Yeah, the support system is such a huge factor. We have a question in the chat. Have you worked with clients with bipolar disorder and also gastro issues?
So yeah, I answered in the chat because I wasn't sure how much more time there is. But yes, I can't think of any gastro issues that would be a contraindication, especially since it's being delivered intramuscularly. Some people tend to get nauseous and vomit from ketamine. I would say maybe about 5%. Vomit, maybe even less. And then nausea, probably a little bit more than that. But so some people who are sort of prone to vomiting or has some sort of gastro problem, then that I would maybe sort of pre-medicate with some sort of anti-nausea medication. So that I've done a few times. The next question I see is, how is this legal? So
Great
ketamine
question.
is a medication that's approved for anesthesia, and it has been for years. And then several years ago, it got approved as well for ketamine-assisted psychotherapy. I can prescribe it, and I just fill out the 29 Gimel to be able to have the prescription go through the KUPA for those for the indications that I discussed about. So we've been doing it, but they do it in several other centers, and they do it at Shari Nefesh and Ketamine in Renana. There's a couple of different places that are now doing it.
Great, thank you. Are there any other questions?
Yes, if I may. First of all, this is very interesting. Thank you. This has been wonderful. A lot of very, very informative data. How long is the protocol? Is there a protocol for PTSD, different one for depression? What is the length, and can you talk about the cost?
Yes, we can.
I'll go first,
Alex,
I guess. Alex, you want to go first?
You can go.
Okay, so it's good to see you, Muli. I just want to say, first of all, that there are many different ways of working with ketamine, and the combination of ketamine and psychotherapy is also very versatile. So we'll be talking about maybe 2 examples out of many, many different ways of doing this. None of the protocols that I know of are very, very deeply scientifically established. Most of them are basically designed either on ECT protocols or on other psychiatric protocols or psychological protocols for treatment. And there is where they differ according to the different diagnoses or different system where they're being done. So the two examples that I'll say is, first of all, and Alex, please correct me about Keter and add on to this, obviously, but there's the first way is saying, let's have a patient come in, we'll see how they respond to ketamine and what their needs are and what their therapeutic needs are, as well on top of the medication's effect. And then we'll build out that protocol. So especially if we're talking about a client that comes in with their therapist, so the therapist and the client will figure out the protocol specific for that case. I think most of the cases in Keter, we probably work that way, meaning, there isn't a specifically distinct protocol according to what diagnosis you had, but we'll build a protocol for you according to what you need, according to what your therapist needs, and according to what the doctor will say, right?
It's very individualized. It's very individualized. Like Eliza mentioned earlier, we do like to say, let's try a minimum of 3 sessions. Usually after 3 sessions, and I try and get those people do those over, like, let's say Tuesday, then the next Tuesday, then the next Tuesday. So over 14 days, they'll do 3 sessions with 3 integration sessions in between those sessions. Or there'll be a third integration session after the 3rd session. But so we're talking like, 3 sessions over 2.5 weeks or so. And then we'll see how it goes. I'm a big fan of what we call the MED, which is minimum effective dose. The minimum amount of medicine to provide the maximum effectiveness of the treatment. We don't want to overdose and we don't want to underdose. So it's really collaborative. It's a combination of the facilitator working. If the facilitator is the therapist himself, so that's a different story. But if oftentimes we're working with the facilitator and another therapist, then it's a collaborative experience. We really want to customize it for each client and give each client what they need. And how each client is affected by the medicine is very individualized. Some people after 1 or 2 sessions can be profoundly changed, whereas some people it just takes a few more sessions. Oftentimes, I'm a big insight-driven therapist, which means that you have the answers inside of you to whatever you need. And what the medicine does is it quiets down the chatter enough for you to hear that wisdom come through. And our job as therapists and facilitators is to help bring that out within you. And so that's kind of how we see it. With regards to, I don't know, did that answer your question?
I just want to add the second part that I was going to say.
Yeah.
So in clinics, especially for example in Shalom Nefesh, where we work specifically with PTSD patients or depression, and usually people come in with both of those situations combined, especially since the beginning of the war. We built a protocol that's based on both ECT, esketamine, and short-term psychotherapy interventions for PTSD. But what we do there is we usually do 6 to 10 ketamine sessions spread out over 3 to 4 months of psychotherapy. So patients in Shalom Nefesh come in twice a week for psychotherapy, and then when they're ready, we add in ketamine. And in the end, within about 4 months, we did 6 to 10 ketamine sessions surrounded by psychotherapy. This is very different from the model that I just said and Alex added on to. And I think that this isn't a more proven method of doing things. I think it's just a different perspective that's putting psychotherapy as the main component and ketamine as the driver or the accelerator in that process. I would just want to say that besides how many times we'll dose and how frequent, also the level of depth in the experience, meaning is it going to be a psycholytic session or a psychedelic session? For me, sometimes that's very much a question of, are we dealing more with a depression type experience where I want to bring in a lot of medicine quickly and have a transformational experience, versus a place where, if we're talking about PTSD, and even more so if we're talking about CPTSD, I want the therapeutic alliance and the connection there to be most of the work. And then we're going to have also psycholytic sessions, meaning lower dose sessions where the client is still able to converse and remember and hold content and not only be focused on the transformational experience. And that's where the relational part of the healing of PTSD comes into play. So ketamine could also be utilized to make the therapeutic alliance better, stronger, the transference more available, etc. So there are different ways of looking at this. In the end, the different diagnoses might demand different frequencies, also different doses, and also different types of integrating that into the psychotherapeutic process. I just want to underline a few red lines under CPTSD treatment and under suicidality treatment. That's where I would say that psychotherapy needs to be much more robust and hold the ketamine experiences, especially with depression that is suicidal. We see that people that are coming out of the depression because they had a really good ketamine experience, maybe, that's when the suicidality can kick in, as we know from other psychotherapeutic processes where depression starts to come out. When people start to come out of the depression, that's where they might actually be strong enough to try and commit suicide. So that's where noticing these changes and being able to adjust the protocol according to that situation is also very, very important. So also another great reason to do ketamine outside of clinical research in clinical work, meaning not in a rigid protocol according to somebody's research design, but in a way that's designed according to the needs of an individual patient.
Thank you, Penny.
Thank you.
I know that we are at our time boundary for today. So if anybody needs to go, we can go. But I want to there's one more question here about the cost of ketamine. So Alex, did you want to weigh in on that, or
I'll quickly go over that real quick. So there's a couple options. I mean, I don't know as much about Schweizer's program with regards to cost. I know it's free, and they have a generous donor that's helping in that. But I think that there's certain criteria. Penny can talk about that to be able to be eligible for their program. With regards to our program, there's the cost, and then there's this is a bit of a chesed project for me. I, Baruch Hashem, have a business in America, a mental health clinic in America. Thank God it's taking care of us here, and so Keter is more of a chesed project. So really, the cost of treatment, just to quickly run down, is it's 1,000 shekels plus mom for the doctor. The medicine's about 500 shekels for pretty much a full treatment. So it comes out to be maybe 100 shekels per dose, 50 to 100 shekels per dose, depending upon the amount. Prep sessions are 500. Everything's based on about 500 shekels an hour. But there is flexibility in that we recently hired interns where we can basically do everything at a half price. So for people who are interested in working with one of our therapists, our lead therapists, stuff like that, it's going to cost about 2,400 shekels per journey. But if you want to work with one of our interns, we can do it a considerable amount less, half or more. We also offer people payment options. We don't want money to become a barrier for people to get treatment. So I'm happy to work with people, work out payment options and payment plans for people. But I just, like I said,
insurance plans, HMOs, Misad HaBitachon.
We're not dealing with that right now, just because it's enough to deal with a new industry in general than to add on the dealing with insurance companies. I didn't want this to be as much of a headache. I'd rather do it for free and give somebody a free treatment than have to deal with insurance companies right now. Maybe one day that'll be something that we add to what we're doing, but at this point, I want to make sure that people who need the treatment can get the treatment. So if it means me working with them or Eliza working with them, we've given treatment away to some people who are really in need. But it's really is a per person. We'll discuss these things individually with everybody. But we offer, like I said, we offer payment options and payment plans. And if a person's paying 200 shekels a month for whatever, it doesn't matter. You just want to make
Alex,
sure.
that's amazing. Thank you for that. Really.
I'll just say on the regulatory side of things and the question about insurance, etc. I think we're about a year or a year and a half away from משרד הבריאות, משרד הביטחון, and the קופות, understanding even the way that ketamine might play out here, together with how it plays out with psychotherapy. In Shaare Zedek, we've had a very, very difficult time getting coverage, not only for the ketamine component, but sometimes even for the psychotherapy component that comes with the ketamine. And we're working very hard to change that, both through advocacy and public lobby, and also getting them to understand how this can work. The best thing for this kind of work is to start doing it, have the success stories, and then bring those success stories into the different ministries and different policymakers. And another one thing that I want to say is that cost effectiveness of ketamine is a very good reason for these organizations to join in this, but it's still, I would say, about a year or two away.
But משרד הבריאות will argue that there is a Spravato that is being reimbursed. So
Right,
how do you deal with that?
But the Kupa is paying 1,000 times more per milligram than what it would be paying for racemic ketamine. So
And it's less effective.
Mhm.
yeah.
So like,
And-
why
and
are we
there's
here to
no
help people or
psychotherapy.
not? I mean, it's a government. It's government BS.
I think that's another whole webinar that we can do about the
Yeah.
regulatory status and etc. But so far, even in the US, because psychiatric ketamine is given through off-label prescriptions, it's hard to get the different insurance companies to cover it. It's just starting to happen over the past year or so. So let's see where that plays out, and I think Israel will follow.
Yes, I think we'll need to have a part two.
Thank you, Ruthie, for putting this together.
Yeah, thank you so much, everybody, for
Thank you, guys.
for
Thank you very much.
participating, for sharing, for your questions, and for your wonderful presence. And we'll have this recording available to those who couldn't make it as
And
well.
if people, we are doing, just a real quick plug, we are doing another training next month. About a month from now, we're starting another training for therapists who want to be able to bring their clients to Keter. Like I said, you do get the experience of the medicine as well. It's an experiential training and an educational training. It's beautiful. It's wonderful. It's fun. Everyone likes to come to the training. So let me know if you're interested. The other thing, if you have other questions, you can email me, hello@keterhealth.com. If you have questions, you want to talk to me, I'm happy to talk to anybody who's interested. Just send me a couple times that you're available to chat, and I'm happy to do that.
Wonderful. Thank you, guys.
Okay,
Thank you,
thank you so
everyone.
much,
Great evening.
everybody.
Thank you
Thank
all.
you.
Thank you all. Thanks, Penny. Thanks, Yitzi. Thanks, Eliza. Thanks, Ruthie.